Well, soon people will start lining up for COVID-19 booster shots, and now you can take your pick of any of the 3 vaccines. 10 TV wants to make sure you're prepared for this next round.
Let's help break down the booster shot options that are out there. To help us, we're joined by Dr. Carlos Malvestutto, an infectious disease physician at Ohio State University Wexner Medical Center. Doctor, thank you so much for joining us this evening.
Thank you for having me.
All right, let's walk viewers through each of these options here.
All right, for someone who got the Pfizer vaccine, do they need to get the booster? And if so, what are their options for booster shots?
So there are specific populations that are at higher risk and where we clearly see that if they received the vaccine more than 6 months, so they completed the series more than 6 months before, then they should consider getting a booster. And those are people over the age of 65, and then people over the age of 50 with any underlying medical conditions. And there's a broad list. So conditions such as diabetes, chronic kidney disease, lung disease, any type of immune suppression, cancer, HIV, or even asthma. So any of these conditions put people at risk of having more severe disease if they acquired COVID-19. So those people then should consider getting a booster. For those who are 18 to 49 and have an underlying risk condition, then the data is not so clear, so they may consider it, and so they should discuss this with their doctor. And also in that category where they may consider it, that also includes people who live in residences or in areas where there may be a high risk of infection, such as nursing homes, or people who work in high-risk settings, such as in a hospital, or, for example, teachers in schools, or people who have to deal with the public and who work in restaurants. So for that population, then they may consider getting a booster. Again, if it's been more than 6 months since they completed the initial series. Okay. So that's it's very similar for Moderna, actually. Okay. And the recommendation is also, it includes the same categories. However, the booster for the Moderna vaccine is half the dose of the initial series. Where it changes a little bit is actually for the J&J vaccine. In that case, there is a recommendation for anybody 18 to 49 who received the J&J vaccine to get a booster. And in that case, they may choose to get a booster actually that is either the same, so the J&J vaccine for a second time, or they may get one of the mRNA vaccines. And there is some data suggesting that they may get a better boost if they get an mRNA vaccine, so either Pfizer or Moderna.
Thank you so much, Doctor, for spending time with us and getting that cleared up. Dr. Carlos Malvestutto, an infectious disease physician at the Ohio State University Wexner Medical Center.